Hot topic presentation COVID 19. COVID 19, the facts. Novel coronavirus is a previously unidentified virus that was discovered December 2019 in Wuhan, China. This new virus causes the disease COVID-19 in humans and is related to the coronavirus family, which causes diseases such as the common cold. Common symptoms of this virus include fever, dry cough, and fatigue. However, more severe symptoms can develop, such as loss of taste or smell, muscle or joint pain, shortness of breath, and pain or pressure in the chest, according to the World Health Organization. Groups most at risk of developing severe symptoms include the elderly and those with underlying conditions, such as high blood pressure, heart and lung problems, diabetes, obesity, or cancer. The virus is spread through respiratory droplets in the air when an infected person coughs, sneezes, or talks, and an uninfected person inhales these droplets either through the nose or the mouth. COVID 19 significance. Despite being related, COVID 19 has been proven to be more deadly than the common cold and influenza. This virus is easily spread from person to person, especially in crowded, poorly ventilated indoor spaces. The time of exposure to the onset of symptoms is 1 to 14 days, meaning that a person can become infected with the virus and present no symptoms for up to 2 weeks, possibly spreading it further. The virus is also more deadly in those with pre-existing conditions, which are fairly common within the United States. Various minority groups are at greater risk of infection and death as a result of COVID-19 due to health disparities. Along with this, when large numbers of people get sick within a short time frame, hospitals can get overwhelmed, resulting in many people who do not receive proper treatment and care. Since COVID 19 is a novel virus, there currently is no vaccine to prevent infections and no treatment or cure to directly attack the virus. All these factors make COVID 19 a serious threat to public health. COVID 19 threat to off campus college students. Unlike the flu, COVID 19 tends to target and spread through young and older adults, not children. The World Health Organization has indicated that children are infected from adults, meaning that adults drive the spread. The COVID 19 pandemic has been very stressful on everyone. However, students have been especially impacted in unique ways. Many were sent home, lost their jobs, classes were suspended or significantly changed, or simply dropped out as a result of the COVID 19 pandemic. The stress of the pandemic has added even more difficulty to a population that already struggles with depression and anxiety. Since many college students live away from home or their parents, they lack the parental authority that would otherwise influence their actions. This manifests itself in college students not following proper COVID guidelines, such as participating in mass public gatherings, not wearing masks, and traveling. On top of attending school, many students hold jobs, with 43% of full-time students and 81% of part-time students employed in 2018, according to the National Center of Education Statistics. This provides 3 separate locations for infection to occur and spread in the college student population. COVID-19 threat to off-campus college students continue. Off-campus housing is extremely popular with college students, and commuters are very common. Both on and off-campus housing can be overcrowded, with many people living in a small dorm or apartment in very close quarters. Unlike on-campus dormitories, off-campus locations can lack authoritative figures such as RAs that would enforce COVID-19 guidelines, meaning that parties or large gatherings can be frequent. Off-campus housing is usually quickly and cheaply built to accommodate the large influx of people needing living quarters. This results in buildings that have poor ventilation systems. This means that stale air within a space is not removed or replaced by fresh air. The World Health Organization indicates that well-maintained heating, ventilation, and air conditioning systems can stop the spread of COVID 19 indoors. However, this may not be the case in off campus housing. All these circumstances and factors make college students a target in COVID 19 spread and infection, especially those within off campus housing. COVID 19 current rate. As of December 2nd, 2020, there are 63,360,234 confirmed cases of COVID 19 worldwide. With this, there are 1,475,825 deaths confirmed worldwide. Within the United States, there are 13,385,755 confirmed cases nationally, while there are 266,043 deaths confirmed nationally, as reported by the World Health Organization. Cases and deaths are increasing worldwide. However, they're increasing dramatically within the United States, where the case fatality rate is 2%. This is depicted in the chart by Johns Hopkins University. COVID 19 potential impact. Within the United States, state and local governments have imposed rules and regulations to control the spread of COVID 19. This includes mandatory masks within public spaces, early closings and lowered occupancy of buildings and businesses, as well as social distancing practices. These rules are not applied evenly within the country, however, and current forecasts of the spread of COVID 19 indicate that with current restrictions, daily deaths and infections are expected to increase during December and into January 2021, before decreasing by the month's end. If COVID 19 is not properly addressed and mitigation mandates are eased, COVID 19 daily deaths and infections are predicted to increase dramatically throughout the month of February 2021, where peak daily deaths are an estimated 5,664 a day, and peak daily infections are 998,803 cases a day, as predicted by the University of Washington using their COVID 19 health data projections. COVID 19 possible solution. To ease the spread of COVID 19 throughout the United States, there are several techniques that can be imposed. Firstly, universal mask mandates are vital to stopping the virus as it is spread through respiratory droplets in the air. By covering the nose and mouth, an affected person can decrease the amount of particles they release in the air, and a non infected person can decrease the amount of contaminated droplets they breathe in. Next, social distancing practices can be imposed and enforced. By staying at least 6 feet apart, as shown by the picture, the droplets that carry and spread COVID 19 are less likely to come in contact with an uninfected person, as opposed to people being in close quarters with one another, where the virus can spread quickly and easily. To further stop the spread of COVID 19, increased awareness on the importance of hand washing is vital. Hand washing and proper hygiene are the first line of defense against infectious diseases, especially COVID. If the public is made aware of proper hand washing techniques, the virus can be fought. While an extreme measure, public health experts can impose mandatory lockdowns and restrictions on travel. Since the virus is spread from person to person, requiring people to stay home and away from public gatherings and spaces can allow experts to gain quick control over COVID 19. Such restrictions would take the form of mandatory stay at home orders where only essential travel, such as to work, to the doctor, or for groceries, is allowed. While such measures will certainly aid in stopping COVID, the World Health Organization acknowledges that lockdowns can negatively impact people and communities, such as those in poverty who may not have a home where they can shelter in place or may have to work daily in order to make ends meet. All methods and potential solutions have been implemented in part throughout the country by the U.S. government and health experts. However, to fully isolate and stop COVID 19, there must be a consistent, efficient, nationwide response that fully administers the required protocols. In the case of lockdowns, people and their governments must use that time to effectively stop and isolate the virus. As indicated by the University of Washington, by simply requiring universal masks, daily deaths and infections will almost immediately decrease starting December 2020. References. References continued.